Hello everyone, I'm Dr. Angela Mattis, consultant ophthalmologist at AB Vision Eye Care, and welcome to Ask Me, our monthly sessions where I answer your pressing questions about eye care. Today's question says, Dr. Mattis, I was previously diagnosed with mild dry eyes, but lately my symptoms seem to be getting worse. In the mornings, my eyes often feel dry, irritated, and sometimes blurry when I wake up. Throughout the day, especially when I'm using digital devices for extended periods, they tend to feel strained, gritty, and uncomfortable. Could you please advise on what might be causing this worsening and what steps I can take to help relieve the symptoms? Okay, well, I must say that was a very comprehensive question and we'll dissect it. Let's start by understanding what is dry eye. Now, dry eyes is medically known as dry eye syndrome, and it occurs when the eyes do not produce enough tears or the quality of your tears is poor. Tears are essential for keeping the surface of the eyes healthy, comfortable, and clear. When tear production or the composition of the tears is disrupted, the eyes can become dry, irritated, and even inflamed. Now let's pause for a minute and let me just mention crying tears, because patients sometimes say to me, why do you say I have dry eyes and I cry a lot? Now, tears produced from crying, known as emotional tears, are slightly different because they tend to have a higher concentration of proteins and stress hormones. It is also of a thicker consistency. The higher protein content makes them thicker, and that causes them to stream down the face a little bit more slowly. Also, emotional tears lubricate the eyes to an extent, but it plays a role in emotional regulation and stress relief. Now, crying tears are temporary. We're not crying every day. And it is really an intense response to an emotional trigger. And it's not really a sign of underlying lack of lubrication that characterizes dry eye disease. Okay, so what are some of the common causes of dry eyes? At the top of the list is aging. As we get older, tear production tends to decrease, making dry eyes more common among older adults, especially postmenopausal females. There's the environmental factors such as windy, dry climate and air conditioning, and certainly prolonged exposure to these and prolonged exposure to screen time can also contribute to drying of the eyes. I'll talk about that more later. Certain medications such as antihistamines, decongestants, and antidepressants may reduce tear production. Health conditions like diabetes, rheumatoid arthritis, thyroid disorders, Sjogren's syndromes, these are some medical conditions that can cause dry eyes because they affect tear production. As I mentioned before, looking at the computer screen for a long time, as was alluded to in our question, it causes reduced blinking and increased evaporation of the tears from the corneal surface, thus causing drying of the eyes. Contact lens wear can also affect the eyes and cause dryness. Also, pregnancy to some extent, birth control pills can impact tear production. So what are some of the symptoms of dry eyes? Again, our person who wrote that question mentioned some of the symptoms. There's a stinging or burning sensation. Burning to the point like if you put Scotch bonnet pepper, sometimes you're seasoning and your fingers inadvertently, after you've held that Scotch bonnet pepper, you rub your eyes. That's the kind of burning you get when you get very dry eyes. It's red and, looking very, very red in both eyes. And they also can become watery. And this may seem paradoxical. Dr. Mattis, why are you saying that my eye is dry and yet still it's watery? Now, in some cases, the irritation from dryness can trigger the eyes to produce a large amount of watery tears to flush out the irritant. However, these tears are of mostly water and lack the necessary oily layer to be effective, and so the dryness persists. Blurred vision. Yes, when your eyes get dry, your vision also gets blurred. And also the feeling of grittiness or sandiness, like something is in the eye. Also, light sensitivity. A very dry eye can cause one to be very light sensitive. Now, dry eyes is a very serious condition. It really can be very serious. And some of the complications of dry eyes can range from mild to the severe. And these include scarring of the cornea, corneal ulcers, severe irritation where you can't even open your eyes, eye infection, and as I mentioned before, it can affect your sight. How do we manage dry eye disease? There are certain tests that we can do, but there is no single test that is done that can diagnose dry eye syndrome. Rather, your ophthalmologist may perform a series of tests, and these include our slit lamp examination. Now, our slit lamp is this microscope, and you sit at this slit lamp microscope, and we check the appearance of the eye for signs of dry eye. So the light is shone in your eyes, and it is used to examine your eyelids because these glands are very important to produce the oily layer. A Schirmer test can be used to put in your eyes as a small little filter strip, and it can be used put in your eye and right at the edge of your eyelid, and it measures the amount of tears that is produced. The tear breakup time. This test checks how quickly your tears evaporate. So a drop of a special dye is placed in your eye, and the slit lamp microscope is used to see how long your tear film remains stable. So these are some of the tests that can be done. So this is a little test that you can actually perform at home. It's called a tear test or a tear breakup test. And we can try this together after you have had a look at the video. How can we treat dry eyes? Now, from all I've said before, it certainly means that the treatment of dry eye depends on the severity and the underlying condition that causes dry eyes. There may be many different treatments that one needs to have done before getting the relief that we need. So some of these treatments include adding tears. Now, your ophthalmologist might introduce you to artificial tears. These are eye drops that are like your own tears, and you can use these artificial tears as often as you need. You can buy artificial tears without a prescription, and there are many brands, and you really should try to find the brand that works best for you. So if you're using artificial tears, say more than 6-8 times a day, or you are allergic to the preservatives in the artificial tears, you should use preservative-free artificial tears. And this is because the tears with preservatives may start to irritate your eyes. There are also ointments. And if your eyes dry out while you sleep, which is very often, you can use a thicker lubricant at night, such as the artificial tear ointment. So we can also treat dry eyes by saving our tears. And what do I mean by that? Everybody's eyelids have a tiny opening where tears drain out of the eye. Now, if you have dry eyes, Your ophthalmologist may suggest blocking the opening to prevent tears from draining out of your eyes. So this is a case where your tear production may be reduced so that what is produced is draining out too quickly. So we block that little opening, and that keeps the natural tears in your eyes longer. And we use a tiny silicone or gel plug called a punctal plug, and this may be inserted to block the drainage that occurs. These plugs may be removed later as needed, and your ophthalmologist can also recommend surgery, that is, to permanently close that tear drainage system so it keeps the tears. We can also stop dry eyes by increasing your own tears. So your ophthalmologist might have you use a prescription eye drop medication. Now, this is not the over-the-counter preparation, which is the artificial tears. This is a prescription medication, and this medication is used to help your eyes make more of your own tears. So that is just some of the ways we attack treating dry eyes. Now, here are some dry eye prevention tips. Try not to use a hairdryer if possible. I know that may be hard for some people, but certainly you don't want to have that hot air blowing into your eyes to cause evaporation of that tear film. Protect your eyes from drying wind and the elements by wearing wraparound glasses outside if it's a very, very windy day. Now, do you wake up with the eyes dry and scratchy? The ointment is where you need to use just before bed at night to prevent that when you awake in the morning. Warm compresses can be placed over your closed eyes, so you can purchase a heat mask and you just wear that heat mask on your lids and keep it for about 10 minutes each evening, and it softens up the oily component of the tears so that it can coat your eyes better. Also, very important, especially these days where everybody's using devices and tablets and phones and so on, give your eyes a rest. Take frequent breaks when you're reading or using a computer or you're driving for long periods from here to Montego Bay. Remember the 20-20-20 rule that says every 20 minutes, look away from your screen, look 20 feet away for at least 20 seconds. Now, this practice allows the eye muscles to relax after prolonged close-up focus on these digital devices. Omega-3 fatty acid supplements, they have been shown by research to support tear production and help symptoms. Does dry eye ever go away? Now, dry eye is a long-term or chronic condition. It means we can't cure it. We can control it, and so treatments can help to manage your symptoms. So by understanding the causes and exploring appropriate management strategies, most persons can find relief and maintain healthy eyes. Thank you for watching. See you next month for our next insightful session. And remember, if you have questions, just drop them in the comment section below. Have a great day.